Hi, everyone. Welcome. First of all, we'll start the session in the next 5 minutes. While we're waiting, I'd like to quickly give you all a brief overview about the project, about Project Aina. So, guys, Project Aina was conceptualized by the Rotary Club of Mumbai Narman Point with the basic idea of spreading mental health awareness. So statistically, all over the world, mental health is a very important topic, and it's in India especially. It's a topic which has not been in the limelight for very long. So the whole objective of Aina is to spread awareness about mental health and its allied topics. So we plan on having a session every week starting today. Um, we'll have one today, and we'll have every week on Sunday, we'll have a session followed by a 2-day power packed session on the 10th and 11th of October. Um, these will cover topics, a lot of topics. So today's topic is an overview of mental health. We'll be covering topics like yoga, meditation, um, topics like art-based therapy, and we have collaborations with a lot of NGOs and a lot of other Rotaracts as well. So it's a pleasure to have all of you all today. Around 7:10 is what we have as our timeline to begin today's session, right? So please stay on. Uh, yeah, thank you. Okay, hi guys. So let's begin today's session. Good evening, ladies and gentlemen, fellow Rotaractors. Uh, Welcome to today's session on an overview of mental health. Uh, this is an associated collaboration between the Rotaract Club of Mumbai Narman Point and the Rotaract Club of Royals. Um, so I'd like to introduce today's speaker, Mrs. Husna Vanjara. So Husna Vanjara is a clinical psychologist, a counselor, and a mental health professional. She's a counselor at esteemed schools like Bombay Scottish Mahim, Don Bosco, Podar, and Janki Devi. She has been associated with Ummeed Child Development Center and has also worked very closely with SINDA, which is the TV and Actors Association. She has expertise in dealing with HIV patients and people suffering from drug addiction. She has a vast amount of experience, over 20 years of experience in working with such cases. And without much ado, Husna ma'am, the floor is yours. Welcome to today's session. It's lovely to have you here with us today.
Thank you so much. A real pleasure. Thank you.
Yeah, so since today's topic is an overview of mental health, let's start with what is mental health and why is it so important in today's world?
Okay. So, mental health basically includes our emotional, psychological, and social well being. It affects how we think, feel, and act. It also helps us to determine how we handle stress, relate to others, and make choices. So, for example, sometimes when we are upset or angry and we have to make an important decision, we end up making a wrong decision. Or if you are angry at somebody and you can't express that anger out, then we end up lashing at somebody for no fault of theirs. So that's how mental health is. That is exactly what mental health is. Mental health is as important, if not more important, than physical health. And most important, your mental health does not always stay the same. It can change as circumstances change and as you move through different phases of your life. So it depends on your life experiences, what kind of experiences you have, and how they have impacted and affected your mental health. Okay. Now I'll tell you why mental health is important. The first reason why mental health is very important because it affects your physical health. So, for example, we have a lot of psychosomatic disorders like acidities, ulcers, eczema. Nowadays, young girls have been diagnosed with PCOD, which is purely stress related. So I'll give you an example. I once had a 30-year-old client who was admitted in Global Hospital for 6 months. And he had various physical ailments. At one point, the doctors even thought it was cancer. So he had different kinds of physical ailments, but they couldn't diagnose what the reason was. Then they realized that now nothing is coming out in the test. You can't find out anything. What's happening, you don't know. So they told him, maybe there's something to do with your mind. Why don't you go and see a counselor? So then he was referred to me. And during the course of therapy, it came out that he was being bullied at his workplace for about a year. And that manifested in this form, and he had to get, he couldn't express it to anybody. He couldn't express it to his wife, he couldn't express it to his friends, he couldn't express it to his friends. So it was all internalized inside, and that's how it manifested in the form of this. So firstly, it's very, very important because it's very, very closely linked to your physical health. Secondly, if you have good efficient mental health, it helps you cope with the normal stressors of life. Everybody has stress in life, so you go through it, you can cope with it. Thirdly, it helps you to have good healthy relationships. So in the sense, you don't keep fighting with people, you don't have arguments. Even at the workplace, you're fine. You can work in a group, you can work with your friends. So that way it helps you work productively, it helps you realize your full potential, and the most important thing is it helps you being content and happy, and it helps you in making the correct decisions in life. So that's how your mental health is so important to you.
Okay. Right. So, what are the factors which are relevant in affecting your mental health? Which factors
Okay.
generally affect mental health?
Okay, so amongst others, the first important factor which affects you is biological. So it could be your genes, it could be something going wrong with the chemicals in your brain because of which you have experienced a mental illness. So those are the organic causes. Okay. Secondly, very important is your life experiences. So, for example, if you have had a traumatic childhood or you have experienced some trauma, for example, parents divorcing, parents separating, and sometimes what happens is when adults fight, they don't realize the consequences it has on their children. So that has a lifelong impact on the mental health of the child if it is not corrected properly. So, for example, if a child who has undergone severe divorce trauma, from his parents, okay, will not be able to make good relationships with his spouse or with people around him because that insecurity, that fear is always within the child. Secondly, these kind of children are very, very vulnerable. They might take to drug addiction, they might take to alcoholism and stuff like that. So it's very, very important that if anybody has undergone a traumatic relationship at home, even domestic abuse, that's on the rise. It happens in all families. It happens even in families like ours. It's not only restricted to the lower class, which is a myth. So if any child has seen that happening, it can affect his own relationship in the future. So that's the first thing, trauma. Secondly, abuse, any kind of sexual abuse, if you have undergone, not spoken about it. So for example, I had a client who was a lady like 35 plus. She was sexually abused by her cousin's husband when she was younger, but she never spoke about it to anybody. So suddenly when she was 35 and she had a daughter of her own, she started panicking about her daughter. She didn't let her daughter go out anywhere. So unsettled, unresolved issues, she tried to do that by controlling her daughter and by being extra fearful about her child. So she didn't let her child interact with anybody. She didn't let her child dress the way the kid wanted to. And it was creating a lot of anxiety within her. So when she came for therapy, she was absolutely fine after that. So you need to resolve all these past issues of yours. Secondly, even bullying is a trauma. So people who have
Right.
undergone bullying, which is very, very, very rampant these days. So I once had a client who was 21, and when he was in school, he was bullied, he was really bullied. Until 21, he was facing a lot of social anxiety. What if I get out and what if I run into those bullies? So as a result, he had become a recluse. He wouldn't interact with anybody. So bullying is another very, very, very important cause of trauma, which could cause you trauma. Lastly, your lifestyle, what you lead. See, nowadays all of us are eating junk food. We are constantly on the move. We don't exercise. We are not physical. A lot of your youngsters are into drugs. You all are into weed, which you all think is safe. You all are smoking. You all don't realize the consequences of all these actions. You know, it says it's safe, but it's not safe in the long run, especially for girls. If you all are smoking, or if you all are taking weed when you all are 20, 25, and you all, 25, 30, when you all want to have kids, you all might face problems in even having children or conceiving. So take care of all that, because what I see in young children, like girls especially, they don't even know how to hold a secret. They're only doing it to be accepted by their peers, which
Right.
is not cool anymore, because you're harming your physical health. That's the thing. So just be careful about all these. Okay. Secondly, lack of food, lack of sleep. When you don't get adequate sleep, too much addiction on social media, which again causes you from lack of sleep, because you're only addicted to that. And another thing with the younger generation, what I have seen is social media anxiety is also lots, because a lot of time people are putting up pictures of themselves, enjoying doing things, and the other person who's watching it feels, oh yeah, I'm missing out on it. Look at Amy's having so much fun, and look at my life, it's all crap. We feel like that. But not all of what you see on social media is true. Half of them is rubbish. Honestly, I had a client who was studying in Canada, and he was so lonely there, and he eventually came back because he wasn't happy studying there. And but when he was in Canada, he told me, he said, I go to the zoo, I'm all alone there, but I don't want to look uncool for my friends. So I post pictures as though I'm having fun. So all his friends would look at that post and comment on that post, oh wow, cool, you're having so much fun and stuff like that. But in reality, the kid is alone at the zoo. So
Right.
social media images, what we see is not always true. Secondly, junk food, unhealthy food. We don't have proper eating habits, erratic eating habits. All this also could lead to sadness in the mind, anxiety. So take care of all this. Lastly, all of y'all are experimenting with sex now and stuff like that. So I have worked with HIV/AIDS patients also. And when you actually get into the reality, it's very sad, because they may have had the first exposure when they're 19 or 20 with girls who they don't know. And then they forget about it. And then 10 years later, when the symptoms occur in them, they don't even know what exposure they had. So what I'm saying is, in case anybody is sexually active or anything, just take precautions, have safe sex. That's the only thing, because don't let it impact your entire life. So all
Right.
these mainly are the most important factors which affect your mental health.
Okay. Since today's session is on depression and anxiety as well. So, I mean, depression is a word which is thrown around very often. At least I've seen it being used very often. So, what exactly is the difference between depression and sadness?
Very good question. So all of us say, oh, I'm depressed. Thoda kuch hota hai and I'm depressed. I'm depressed. Okay. But that's not depression. That's sadness. Okay. So all of us have times when we are feeling low, when we are upset, when we are anxious, when things don't go our way. When supposing you work very hard for an exam and you don't get the desired marks, you are upset. When we don't have enough money, we are upset. When we have a breakup, we are sad. Okay. But life carries on. Sadness doesn't interfere in your day-to-day functioning. You forget about it. After a few days, you're crying, you're weeping, and then you move on. So it doesn't affect your daily functioning. But depression is a mood disorder. It's actually a disorder which affects how we think, feel, and behave. It interferes with our day-to-day functioning. So it interferes with our, like, there may be times when you don't feel like getting out of bed. So that is depression. So when you're depressed, you have sadness as one of the symptoms of depression. Sadness is not depression. Sadness is one of the symptoms of depression. You may have a low mood. You may have a lot of anger. You may have demotivation. You may not feel like you are not motivated enough to do anything in life. Okay. You have a feeling that life is very bad and nothing good will come out of it. So basically a feeling of hopelessness. कि कुछ नहीं होने वाला है आगे. Often there is too much sleep, there is too little sleep, too much eating or too little eating. Also, general feeling of lethargy. Sometimes we have clients coming up and saying, oh, it's so difficult to get out of bed, I just can't face up to the world. So this is depression. Then probably the most important aspect of depression is the fact that the person starts thinking very, very negatively about themselves and about other people also. So first they start thinking about suicide, okay, which is a thought first, and then it becomes a reality, and then it becomes an action. So these are basically the symptoms of depression, but you have to have the symptoms for at least 2 weeks to be diagnosed as depression. And depression is 100% curable, provided you go to the right person for help and you seek help.
Well,
Then
yeah.
it's curable.
So sadness is temporary, whereas depression is
Sadness
prolonged.
is completely temporary. Depression is prolonged, but it should last for 2 weeks. And see, all of us have been sad. Can I ask somebody here, how do you all feel when you all are sad? If you all can just type or speak, if you can unmute the mic, yeah. I think Arushi wants to say something, yeah. Just slow, absolutely, yes. What else? Tell me. Anybody else? How do you all feel when you all are sad? Irritated, yes. Frustrated, absolutely. But hopeless, yes. Yes, okay. But do these feelings stay or do they pass? Moody, somebody is writing. So how long have you all experienced, yeah, disheartened? How long have you all experienced this feeling within you all? Is it temporary? A few hours? Yes, just a day maybe, exactly. A day at the max. Short durations, yes. Okay, so supposing if you all are sad, if you all experience these symptoms, okay, and if a friend calls up and say, chalo, chalo, we are all going out, we are all going to party, will you all feel like going or no? No, okay. Depends, okay. But you will think about going, right? At least. Yes. So maximum people have written yes, 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 eventually maybe. So that is sadness. But if you're depressed clinically, then you won't feel like going, because you withdraw from activities and people who you used to hang out with once, or activities which you used to enjoy. So for example, if you used to like going out, used to like going interacting with your friends, you wouldn't want to do it anymore. So that is the difference between sadness and depression. With sadness, you move on. With depression, you're stuck. You don't move on. You feel life is not worth living. It's hopeless. So for depression, you have to undergo therapy. That's how you come out of it. I hope everybody has understood, because this is a very, very important difference. So next time when you're upset, please don't say I'm depressed. Just say I'm sad.
I think we're going to use that a lot now.
Yeah, please use that a lot.
Yeah, because it's a better word. I mean, I think everyone should today, learn about the difference and use the right word.
Absolutely.
Anyways, so the second, after depression, we're talking about anxiety. So what exactly is anxiety? And yeah.
Okay.
What do you mean by
so
anxiety?
to the lay person, anxiety is a kind of घबराहट. Hindi mein we say मुझे घबराहट हो रही है. It's a kind of nervousness, tension about the future. It's nothing related to the past. It's like क्या होने वाला है. So for example, you're studying for a paper. Okay, there are two friends who are studying for the paper. One friend entire night is away getting stressed. I will not know anything. I will fail. I don't know what I'm going to write. I think I'm going to sweat in the paper. I'm going to be nervous in the paper. Okay, these are his thoughts. He's anxious. Whereas the other friend is very calm, very cool in the situation. So it's in the mind. You get what I'm saying? So all of us feel anxious, right? So when we feel anxious, what do? Haven't there been times when we have a lucky pen, you write your paper with this lucky pen, or you have a lucky t-shirt which you wear and go for the exams, right? So at times people tend to become superstitious when they are anxious. Then you start bribing God that, oh, I'll go to the temple, I'll do this, I'll do that, only for that temporary minute, temporary moment. If my paper goes well, I'll do this. So you become superstitious. Secondly, you may run to the washroom several times. Again, you may sleep too little because of the stress which is happening inside your head. You may feel nauseous, you may feel acidic. Sometimes what happens is, with the amount of stress you have, you may even land up in hospital with symptoms similar to a heart attack, what we call as panic attacks. Okay, so the
Right.
doctors there might examine you and tell you that no, yeah, you're absolutely fine, there's nothing clinically wrong with you, your heart is absolutely fine, maybe there's something happening in the brain which is not right. Okay, so then you again refer to a psychologist, and then you're, then is brought to your notice that you're anxious. So anxiety is, it's a state of mind. So two people in the same situation might not be anxious. It's about your thoughts and what you are feeling. That is why you are anxious.
Right.
Okay. So I'll give you some tips on how can you all manage your anxiety, basically. So when you're anxious, you question your thought patterns first. Since all of you all are young, you all are educated, you all know, So you'll question your thought patterns. Are these thoughts logical, or are they made up? So basically your fears. So you have studied for the exam, then why are you so nervous? Question your thought. I have studied, so why am I nervous? At the most, kya hoga? The paper is tough, I'll fail, big deal. But what if the paper is not tough? By me getting anxious, I'm not studying properly, I'm not giving that quality of time which I should study, I'm wasting all my time being anxious. So question your thoughts, write down the thoughts which come into your head when you're anxious, and look for triggers. So if you feel you're getting anxious before a particular incident, note it down and try and seek the reasons why you're anxious, and you will arrive at your answer yourself. Secondly, focus deep breathing exercises, which is very important. And lastly, any form of exercise. So when you're actually anxious, go and take a walk, start jogging, practice yoga, exercise. So basically, these are tips on how you can deal with anxiety.
Okay.
Yeah,
Now,
so I'm sure
so,
everybody feels anxious. Or all of you all may be feeling anxious for different reasons. But I hope you all will work on it now by this.
personally, I think exams are a big trigger for anxiety.
Yeah, they are. Yeah, they are. But tell me something. Does it really help?
No,
I
it
mean, does
does.
your anxiety help?
It doesn't. I mean, you have to give a paper, you have to give an exam. Then, if you've studied for it, you're
Yes.
definitely going to pass.
Yeah, exactly. Exactly. And all that time, when when you're feeling anxious, you're wasting that much time in thinking negatively about the paper, right? You may as well use that
Right.
time productively and study.
Oh, you've got a question.
Questions we'll address later, or you want to address them now only?
I think we'll address them at the end. We'll keep
I
a
think so,
10-15
better.
minute yeah
Yeah,
space for
okay.
addressing questions. Yeah. So okay. So now I've often got confused between the difference between like a psychiatrist, a psychologist, and a counselor or a therapist. So what exactly is this difference? Is there a difference?
Yes, yes. There's a lot of difference. So basically, a psychiatrist is somebody who's a medically qualified doctor who will give you medication if you have a mental illness. Okay. A clinical psychologist will do the assessments to diagnose whether you have a mental illness or not. Okay. And a counselor or a therapist will do the counseling and the therapy part of it. Okay. So for example, if somebody is depressed, okay, somebody comes to a clinical psychologist. Okay. So the clinical psychologist will assess whether this is clinical depression. Yeah. Counseling say he'll get okay with it. If the client, if the psychologist feels after taking the history that the client might not get okay with only counseling, then the clinical psychologist does the psychological evaluations to find out how deep is the depression or how intense is the depression. Then the clinical psychologist refers the client to the psychiatrist who prescribes medication, and the psychiatrist and the therapist work together with the counseling of the client. Okay, but one thing I want to bring out very clearly is when y'all are going to see a counselor or a therapist, make sure that the therapist or the counselor is well qualified. So you need to ask the counselors their degree, whether they have had a master. So clinical psychologists most of the time do counseling also. Like I'm a psychologist. clinical psychologist, but I have done my counseling course, so I even do counseling. But there are some counselors and therapists who are not qualified to do it, but they just do some few random courses and they call themselves counselors and therapists. So y'all need to be very sure who y'all are going to, because it can do more harm than good. And not
So
all mental illnesses, sorry, not
what
all mental
qualifications?
illnesses, yeah, one sec. Not all mental illnesses need medication. Most of them just go away with talking, and I have seen clients who come to talk, they are there for 3-4 sessions and they're absolutely fine after that.
So
Yeah,
just a
so
sub
tell me, yeah,
question.
this, yeah.
Since you were discussing qualifications, if somebody goes to a psychologist, what kind of qualification should one look for?
So clinical
A master?
psychologist has to do a master's in clinical psychology to practice as a clinical psychologist, and a counseling psychologist also has to do a master's in counseling psychology. Or even the course from Xavier's, what I have done, empowers you to work as a counselor. But don't get people who have done a 3-day course and a 6-day course and a one month course calling themselves as counselors. So I knew
Right.
someone who was a fashion designer who did a 3-month course and was counseling kids, calling herself a counselor. So these kind of people stay away from, I would say.
Okay. So as a psychologist, do you think maybe should change? There should be a change in people's perception about mental health in India. And do you think it should be taught in schools and at home as a part of parenting?
Of course, so mental health has always been a subject which is taboo. Nobody talks about it. So for example, if you have a fracture or a heart ailment, or you cut your hand and were in any kind of physical pain, you would immediately rush to a doctor and get it treated. But somehow, if you were in any kind of mental trauma or emotional trauma, you will feel ashamed to go to a psychologist. I don't know why. But maybe there's stigma, there's guilt, there's shame, whatever it is, but there is, that thing is still there. Like I have worked in schools, and if the child is behaving badly in class or is depressed or upset, the parents will never come to meet the counselor, even though the school has told the parents. But if the marks of the child are suffering, the parents will run to the counselor. So this kind of, I mean, it's all marks, marks, marks. But for your emotions, your thoughts, people hesitate to go to a mental health therapist. But this is changing now, especially with the younger generation, with y'all, because y'all are also being proactive in in uh, in helping out people with mental health issues. So it's changing with, like, I have young clients, my friends' kids, who I've seen at some point in time, okay, but the parents are very hesitant to tell others that their kid is going for help, but the children are okay. So the child will say, I've gone to a therapist, So it's changing now, and the onus is on to your youngsters now to change that perception about it. So people say, am I mad? I don't need to go to a therapist. Arey, you're not mad, but if you're mentally you're not okay, physically you'll never be okay, no matter what you do.
Right.
You may have the best of clothes, you may live in the best of house, you may have the best of material wealth, whatever. But if you're mentally not okay, you will not want to enjoy those things. So your mental health is so important. But it is changing with the current generation, which I'm very happy about. Schools should have a mental health period at least twice a week, where children are taught about different emotions. Because in India, we have this thing to suppress emotions. We don't talk about our emotions, So where children are taught about different types of emotions, they are taught about what is anger, how to express anger in a healthy way. Anger is a normal emotion. Everybody feels angry, but how you express this is the problem. So you can't go and hit people. You can't be aggressive. You need to be assertive. So when children are taught about that, it will really help them. Secondly, if children are taught about how to handle bullying, which is so rampant. Thirdly, they're taught how to respect women, how to have safe sex, how to stay away from drugs, from alcohol. It will definitely change the mindset of the younger generation. Those schools are doing it now. They are doing it. Most schools in Bombay are doing it. But the only difference is it should be a regular thing and children should be encouraged to talk. Thirdly, parents should encourage kids to discuss about their feelings and emotions. Normally, what we see in parents is that they are only lecturing the child. I'm telling you all this because you all are young adults. You all will grow up to become parents in the next few years. So, so you all know what to do with your kids. So basically, Indian parents only lecture their children, they're only advising them, they're only yelling at them, they're shouting at them. They don't delve into their emotions, they don't speak to the children, they don't ask the children what they are feeling. It's only about instructing, lecturing. That's what I feel. So kids don't confide in their parents. They go and they confide in their friends, from where again they're getting wrong information. So if parents are more open to the idea of talking to their children, discussing their emotions instead of only discussing their academic achievements, it will really make a lot of sense. Secondly, in our society, there are some stereotypes which really need to go. For example, boys are always told boys should not cry, be a man. So if a boy is upset, the boy is not taught how to express his emotion. He said, you shouldn't cry because you're a man. Okay. So we often hear this told to our brothers and our family friends and everybody. As a result of this, what happens is boys have a tendency to suppress their emotions, and they turn away from them, and they ignore them. So crying in men is seen as a sign of weakness and being unmanly, you know, whereas crying is a natural emotion. It is a healthy release. It releases chemicals like oxytocin, which are calming and beneficial to everybody. So even if men cry, so what? So I'll give you an example. So if a woman has lost a husband after being married for 50 years, if the woman cries, everybody sympathizes. Oh, poor thing, this, that. But if the man cries, he can't cry. Why? He doesn't miss his wife. He's not in a state of being upset or sad. His wife is dead. But no, so these are the stereotypes which all youngsters need to change.
Definitely. Okay, so let's now go into, like, I mean, mental illness. So let's say somebody has a mental illness. What signs would signify that the person has a mental illness? What are the signs of mental illness?
Yeah. So basically, all the symptoms have to last for at least 2 weeks. Get that clear, because sometimes symptoms overlap, sometimes they happen on and off, but they have to be consistently happening for 2 weeks, and y'all should not sit and self-diagnose. Immediately contact a mental health therapist, please. Okay. So basically, it's a change in eating pattern, sleeping pattern. You may eat too much, eat too little, sleep too much, sleep too little. Okay. Not get any sleep, withdrawing from people and activities you used to enjoy once, having low or no energy at all. You feel tired and fatigued for no reason. Okay. Then unexplained aches and pains. My leg is paining, my head is paining. You don't know why. Okay. Feeling helpless, hopeless, and like the world, kuch acha nahi hone wala hai. I'm like doomed. I'm going to die. This is bad. This is the worst thing which can happen to me. Those kind of feelings and thoughts. Smoking, drinking, using drugs more than usual, feeling unusually confused, forgetful, angry, worried, or upset, having severe mood swings. So, sometimes you're very, very happy and on top of the world. Sometimes you're very sad and depressed and you don't know why. So, there's no obvious reason for it. Hearing voices or seeing things which are not true, thinking of harming yourself or others, and very important, not being able to perform your daily tasks, like not wanting to go to work, not wanting to go and exercise, not wanting to go for a walk, not wanting to study, not doing household chores, not doing hobbies what you used to enjoy. So these are all the signs to for if you have a mental illness. But I'm again telling you, 2 weeks you need constantly to make a diagnosis, a correct diagnosis. Yeah.
Okay. When does one need to seek help?
Yeah. So if you have any of these symptoms for a prolonged period of time, which interferes in your normal day-to-day function, that's the time when you need to go and seek help.
So 2 weeks is about.
Yeah, 2 weeks and more.
So let's
But
say
see,
that that someone is suffering from prolonged sadness, which turns into depression after 2 weeks. So would one then?
It doesn't turn into depression after 2 weeks. If you have all these symptoms or some of these symptoms, it would turn into depression. But if you're sad for say a week or something, you want to pick up the phone and talk to a therapist, please do it.
Okay.
Because talking will only make the burden feel lighter. And what happens, see, many children or many adults also have this misconception that therapy mein kya hota hai. Therapy में कुछ नहीं होता है. It's like how I'm talking to you, I'll be talking to you then, or the therapist will speak to you then. So there is no internal invasion of medicine, as in the case of a physical illness. So that way, mental illness is more safe because you're only talking it out. You're not putting any chemicals into your body unless it is a clinically diagnosed mental illness like schizophrenia or bipolar or clinical depression. That's it. So you're basically just an exchange.
Okay. Finally, do you have any tips, any suggestions to improve our mental health?
Yes. So the first one is learn to value yourself. I have children coming to me, or young teens, adults coming, who keep criticizing themselves. Oh, I'm not good enough. I feel I'm fat. Look at my friends. I'm dark. I'm this. I'm that. Okay. Learn to value yourself because every individual is different. Treat yourself with kindness and respect. Most important, because only if you learn to value yourself and if you love yourself, will others want to do that to you. And even if others don't, it's fine because you are happy within yourself. So self-esteem is a very, very important thing. Self-esteem is basically what you think of yourself. So when you think you're good, no matter what somebody else tells you, you will never believe that you're not good. Okay, so first important thing is learn to value yourself. Secondly, take care of your body. As I said, exercise, no substance abuse, the disciplined lifestyle, exercise, none of this weird crap which all these youngsters are doing. All of them are doing, honestly. So I had a client, a kid, 21 years old, who was taking this Indian weed for about a year. Okay, 1 year. Indian weed, why? Because it's cheap. But then another kid who comes to me for therapy had come to me. He's now out of therapy. He told me Indian weed contains rubbish and stuff like that. And true enough, because this kid started getting, he was having rash on his body for about a year, which they couldn't diagnose what it was. And then he started getting something called erectile dysfunction, which they later found out was because of the weed. So when we say that weed doesn't harm, it would definitely harm. Especially, I'm telling all the girls who are listening here that it's not cool. Please don't play around with your bodies because it shouldn't be too late when you'll want to have kids later on. Okay, so surround yourself with positive people. Stay away from negativity in life. You know, we all have friends who are negative, who keep criticizing us, maybe because they have a problem with us, or they are jealous of us, or they are envious of us. You need to stay away from such negative people. So please stay away from negative people. Stay with positive people so they enrich your lives. That's very important. Even volunteering for a charitable cause is very important, like what you all are doing, paying for the mental health of the underprivileged, which is so good because at the end of the day, you all will feel good yourselves doing a good job, good deed outside, you know. So always try and volunteer, try and help people without being selfish. So nowadays I'm seeing a lot of these kids, you know, 11th and 12th standard, promoting social service. Oh, we are doing this, we are doing that. But why? That's all an aim to go abroad, you know. So that will not give you the satisfaction because you're doing it with an ulterior motive. But when you don't do it with an ulterior motive, you see the satisfaction which you all get within yourselves. After that, learn how to deal with stress effectively. Don't get harrowed, don't get hyper. Learn how to deal with stress. Set realistic goals for yourself. Very important. So when you all are entering the profession also, supposing if you all are lawyers, you all have to be prepared to work from an associate level, and they'll make you do all the dirty work and stuff like that. So be prepared mentally that you are going to face the grind and do it. You all, to become a partner in a law firm takes about 20 years, but you need to go through the grind. So please set realistic expectations for yourself, because when these expectations are not met is when the problem begins. Then lastly, the most important thing I would say is gratitude. Follow the practice of gratitude. Be grateful for whatever y'all have. Anything small also y'all have, be grateful, because remember, there is somebody else in the world who doesn't even have that. So for example, during this lockdown, we all were complaining, you know, we are stuck at home. Oh, we are stuck at home. It's so boring. It's so boring. But we forget that we have a house. There are so many people who don't have houses. So many migrants have gone back walking to their villages without water to drink, without food to eat for days on end. They've been walking in the hot sun, you know, and so many of them have died going there. So when we complain, when we think about negative things about what we don't have, we should consider how we have everything. So what I would say a good practice to begin with is when you all wake up every morning, think or write down the 5 blessings what you have in your house or in your life. Sorry, so not in your house, in your life. So it could be something as basic as having electricity at home, which many people don't have. You see people in Dombivli and all, they don't have electricity. From 9 o'clock in the morning to 8 o'clock in the night, there is no electricity in their houses. So be grateful for these small things, stop complaining, and you see how things will turn and your mental health will be absolutely fine. And most important, seek help when you need it. Don't shy away from help. Another thing in therapy is the law of confidentiality. So whatever you tell the therapist, okay, is between you and the therapist. So even if supposing if you're coming for therapy and your sibling is coming for therapy to the therapist will not disclose what you have discussed with your sibling or what your sibling has discussed with you. So the rules of therapy are very, very precise, that the confidentiality thing is very, very strong. Secondly is when you go for therapy, trust your therapist to the fullest. Your therapist will be non-judgmental, so you can share your deepest fears with the therapist. That's most important, because unless you don't, you will not get help. So this is ways how you can exercise as much as you can, because exercise releases good hormones in the body, which makes you feel good. It takes care of your respiratory illnesses, cardiovascular illnesses. It takes down your stress levels. So anytime exercise. But even when you exercise, we all say physically fit. Physically fit is your bodily fit. But to be physically fit, you have to be mentally fit also. So for example, we see so many people who are very fit physically, but they die, especially when they have the marathons and all that. You see people running and they've been practicing for days on end, but one fine day they collapse and they die. And then later on you come to know, oh, he was undergoing so much stress. So the physical fitness is there, but the mental fitness is not there. So to be optimally physically fit, you need to work in tandem, mind and body again. So that's why mental health is so important.
Right. Okay, anything else you want to say before we begin? Anything else you want to convey to the audience before we begin with a question and answer round?
No, I'm fine. I think that's okay. Yeah. But whatever I've said is enough. In case if they have any questions, I'll be very happy to answer them.
Right. So everyone, the floor is open for questions. Can all of you all just put it in the chat box? Yeah.
So Simran Rele says, I'm an aspiring fashion designer. Please, can you repeat the question, Adil?
So what she says is, I am an aspiring fashion designer. I find myself just usually, and it has begun affecting my work. I'm emotionally attached to my art. There is a lot of negativity around in my industry, usually, and since my career is largely based on my emotions, how do I avoid it from affecting my career?
Okay, now I have explained everything to you all. Okay, can somebody answer this question for her, and then I will give my input. So let me also figure out what you all have learned from the session.
Right, I think that makes sense.
Yeah, so I also know how much you all have gauged from the session.
Yeah, so if somebody is volunteering to unmute themselves and, answer ma'am's question.
Yeah, please. I think Ridansh is trying to say something.
Ridansh, you're on mute.
Okay, so we'll address this later. Yeah. Okay, I'll answer it. Let's not waste time. That's a good one. Wear your gloves. So see, again, what I said was anxious. She's worried about the future. What is going to happen? Okay. Again, it's in her mind. It's manifesting in her mind. So how would she feel better? Tell me, because she's thinking all these negative things, it's affecting her, right? So when you stop thinking the negative things, it will not affect you. And another thing I said is about the self-esteem. So every industry is like this, okay? But when you think you're good enough, and because you're starting out, people will be there to correct you. So if you take it in a positive way that, okay, they are correcting me, a lot of your issues will get solved. But if you think it negatively that, oh, they don't like my art, or they don't like what I'm doing, or they don't appreciate my talent, is when the problem will come. So you have to change your mindset, because you're still young, you're still starting out, there is a lot of competition. You will learn from your seniors. And if supposing somebody tells you, okay, like your sketch is not right, or your color combination is not right, take it in a positive way and use it as a learning experience. And whenever you get anxious, as I said, think about the thoughts which are coming, and are they logical, are they rational? So see, to be anxious, to stop being anxious, we can stop our thoughts. That's the only thing we can do. So I
Okay,
hope
can we
I've
move on?
answered her question.
Yeah, I mean, Simran, if you want to unmute yourself and just clarify.
Yeah,
Okay,
she said thank you. Okay.
right. So yeah, we can move on to the next question. It's by Mahavir.
So Mahavir said a very good thing about the introverts, right? Wasn't his question about introverts?
Yeah, that was his question.
Yeah. What did he say? If you're happy being an introvert, can you just ask him to type the
So
question?
what he
Mahavir,
says
please, can
is,
you type the question?
yeah, so I'll read it out if you want.
Yeah.
So he
Yeah,
says
please
that
do.
would questioning why you are anxious always help? Also, what do you think about introverts who are comfortable talking only to some people? And how would therapy help them?
So the first one is, yes, questioning your thoughts about anxiety will definitely help, because most of the thoughts are illogical. They are what you are thinking. They might not be rational. They might not be, but they might not be logical. Okay, so if you question your thoughts about the anxiety, it will definitely help. Secondly, introverts don't need therapy. As long as you are comfortable in your own skin, it's absolutely fine what people say. So introverts don't need therapy unless you're not happy about being an introvert. But if you ask me, it's absolutely fine being an introvert. Okay, you have a few close friends, it's okay. It's not necessary you have 1,000 friends. But if you are happy having few good friends, it's absolutely fine. You don't need help.
Right. Okay,
What
guys.
would you say
If
to a
you're,
friend who says, I feel
yeah, if
like
your
cutting, or
question
any
is
other
answered,
suicidal thoughts?
can you
Yeah.
put it in
So can
the
I
chat
answer that?
box? Yeah, definitely.
Yeah. So I would say that, try and ask him why he's upset and try and deal with it. But please remember to refer him to someone for help, because today, if he's talking about suicide, tomorrow he might end up doing it. So if a person is getting these suicidal thoughts, you need to send the client for therapy. You all cannot handle it yourself. Please remember that. So even if somebody, we always say that barking dogs seldom bite, if he's saying I'll commit suicide, but it's not true anymore. It was true in the earlier days, but nowadays people have had a lot of guts and courage to commit suicide, honestly. So if anybody, you hear anybody talking that, oh, I want to kill myself, I want to commit suicide, please refer him for therapy. Try and convince him to come for therapy, please.
So we've got a question from Pooja, and we've got a continuing question from Mahavir. So Mahavir,
Okay.
regarding the introvert aspect, so what he says is not for being an introvert, but if they need therapy but aren't comfortable talking, then how would therapy help?
So that again depends on, like, I have had a lot of clients who are introverts, but you know what happens is when you go for therapy, okay, there are introverts, but the minute they see that, okay, you're comfortable with the therapist, they will talk, because you have to talk. If you don't talk, how will the therapist understand what the issue is? So you need to put your trust and faith in the therapist. As I said, the therapists have a non-judgmental attitude. We are here to help you, and we are not monsters. So you can talk to us. It's like this. It's like a normal conversation. So you need to let go of your boundaries and and you need to come out. So initially 2-3 sessions will be difficult for an introvert compared to an extrovert who will want to say, tell everything about his or her life to the therapist. So the introvert will take a little more time to open up, but they eventually do, because we do have techniques in counseling which help the introvert to open up also.
Okay, so
Yes,
maybe we'll move on to we'll
Tarun.
first Pooja's question. I think
Okay,
she's
sure.
waiting.
Yeah, sure,
Yeah,
sure, sure.
so she's saying that from the past week she's been feeling lonely, negative around everyone. She doesn't want to get out of bed. She's sleeping for long, eating too much. She wants to know whether this is depression.
It has to be there for 2 weeks more. Another week, one more week. But if Pooja, you're feeling like that, just pick up the phone and call. Please just call any therapist, because I know it's a miserable state to be in, and to be like that for a week more will be more depressing or upsetting or sad. So if you are feeling like that, just take 1-2 sessions of therapy and you'll be fine. Don't wait for too long for it to be diagnosed as clinical depression. So if you feel like that, just go in for therapy, talk it out. That's it. That's all.
Right. So we've got one last question.
Tarun asked something.
Yeah. So if one is experiencing frequent and difficult but short phases of sadness, shall we seek help for that?
Yes, better. And
Okay.
as I said, unless if it's not a very intense problem, okay, 4-5 sessions, you're good to go. If it's not sometimes what happens is, especially y'all are young, growing adults. So y'all don't have anybody even who y'all can share or y'all feel will understand y'all. Parents don't understand. That's what y'all think. Okay. Your friends might not understand, or you may not want to share some sensitive information with your with your friends. So that gets eating, that eats you up. But the minute you share it with somebody, your burden is lightened and you automatically feel better. So that is not even therapy, it's just an exchange of your ideas, or just venting out what you have kept bottled inside for so long.
Right. So we've got one last question, and I think that's all the time we have.
Oh, yeah.
But y'all can connect with ma'am. Hosna ma'am, would you talk to us about what kind of how people can connect to you with questions?
Yeah, so y'all can connect on my email ID, hvanjara@hotmail.com. Everything is small. Or Instagram, but I'm not very active on Instagram, but I do check it once a day. It's husna.vanjara.
So don't worry, we'll share the details on to everybody who's part of this, right? So yeah, before we close, one last question. Yeah, it's from Janisha. What would you do when you don't have a reason, but you just feel sad?
So sometimes it's even hormonal, especially in girls, before they are going to get their periods or something like that. So that's when you also feel sad, just for no apparent reason, but it goes away. So just before you're going to get your periods, a day or two before you're going to get your periods, or 3-4 days before you're going to get your periods, you do feel a little low, you feel lethargic, you don't feel like doing anything, you feel upset. I have friends who used to end up fighting, who used to cry for no reason. So all this happens just before you're going to get your periods. But if it's happening for a long period of time, Janisha, without you knowing why, then you need to probe a little into it. That's why it's happening.
Right. Okay. So thank you so much for being here, Hosna ma'am. It was lovely, absolutely lovely to have you, and
so
thank
much.
you so much for giving us your time on a Sunday evening. And
thank you so much. I'm very touched. I'm very happy that your youngsters are doing so much in the field of mental health. It's really, really very good. And anytime anybody needs help, please feel free to approach me. No problem at all. We can have more sessions like these if you all want. If you all can think of a particular topic, like bullying, for example, or peer, like when friends put too much pressure on you, that kind of a thing. Any topic you all want to be discussed, I'm open to discussing it. As long as people get help, I have no issues at all.
okay.
Yeah, thank you so much for having me.
Thank you. Okay. Also, thank you everyone for being present with us here today. Thank you to the Rotaract Club of Mumbai Rayas for collaborating with us. Hope you guys have a nice whatever's left, and stay safe. Yeah.
Okay, bye. Thank you. Bye.